51. A patient with severe hypercalcemia is at risk for which of the following complications? A. Renal failure. B. Hypoglycemia. C. Diabetic ketoacidosis. D. Hypotension. Answer: renal failure. Rationale: severe hypercalcemia can lead to nephrocalcinosis and renal failure due to calcium deposition in the kidneys. Hypoglycemia, diabetic ketoacidosis, and hypotension are not directly associated with severe hypercalcemia. 52. Which of the following is the most common cause of Cushing's syndrome? A. Pituitary adenoma. B. Chronic corticosteroid use. C. Adrenal carcinoma. D. Hyperthyroidism. Answer: chronic corticosteroid use. Rationale: the most common cause of Cushing's syndrome is the prolonged use of corticosteroids, which leads to suppression of the hypothalamic pituitary-adrenal axis. Pituitary adenomas and adrenal carcinoma can also cause Cushing's syndrome, but chronic steroid use is the most common cause. 53. What is the primary mechanism of action of insulin? A. Increases glucose uptake by cells. B. Decreases glycogen breakdown. C. Stimulates glucagon secretion. D. Increases hepatic glucose production. Answer: increases glucose uptake by cells. Rationale: insulin facilitates glucose uptake into cells, helping lower blood glucose levels. It does not stimulate glucagon secretion or increase hepatic glucose production, which are actions seen in other hormones like glucagon. Decreasing glycogen breakdown is part of the metabolic process in response to insulin. 54. A patient with diabetes is experiencing blurred vision and numbness in the hands and feet. What condition does this suggest? A. Diabetic neuropathy. B. Diabetic retinopathy. C. Diabetic ketoacidosis. D. Hyperthyroidism. Answer: diabetic neuropathy. Rationale: blurred vision and numbness in the hands and feet are symptoms of diabetic neuropathy, a common complication of long-term uncontrolled diabetes. Diabetic retinopathy affects the eyes, diabetic ketoacidosis presents with different symptoms, and hyperthyroidism is not associated with these specific symptoms. 55. Which of the following is a characteristic sign of adrenal insufficiency? A. Fatigue and hypotension. B. Hyperactivity and weight loss. C. Excessive thirst and urination. D. Hyperglycemia and weight gain. Answer: fatigue and hypotension. Rationale: adrenal insufficiency presents with fatigue, hypotension, and electrolyte imbalances due to insufficient cortisol and aldosterone production. Hyperactivity, excessive thirst, and hyperglycemia are not typical signs of adrenal insufficiency. 56. A patient diagnosed with hypothyroidism is being treated with levothyroxine. Which of the following is the priority nursing action? A. Monitor for signs of hyperthyroidism. B. Educate the patient about a low-calorie diet. C. Encourage increased physical activity. D. Administer the medication at bedtime. Answer: monitor for signs of hyperthyroidism. Rationale: when initiating or adjusting levothyroxine treatment, it is important to monitor for signs of hyperthyroidism, e.g., tachycardia, irritability. While diet and exercise may be important for overall health, they are not the priority in the early stages of treatment. Administering the medication at bedtime is not recommended. 57. What is a common symptom of primary hyperaldosteronism? A. Hypertension. B. Hypotension. C. Hypoglycemia. D. Weight loss. Answer: hypertension. Rationale: primary hyperaldosteronism is characterized by hypertension due to aldosterone-induced sodium and water retention, leading to increased blood volume. Hypotension, hypoglycemia, and weight loss are not typical symptoms of hyperaldosteronism. 58. Which of the following is the most common cause of hypothyroidism in developed countries? A. Autoimmune thyroiditis, Hashimoto's thyroiditis. B. Iodine deficiency. C. Pituitary tumors. D. Thyroid cancer. Answer: autoimmune thyroiditis, Hashimoto's thyroiditis. Rationale: in developed countries, The most common cause of hypothyroidism is Hashimoto's thyroiditis, an autoimmune disorder that leads to the destruction of thyroid tissue. Iodine deficiency is the most common cause of hypothyroidism worldwide, but it is rare in developed countries. Pituitary tumors and thyroid cancer are less common causes of hypothyroidism. 59. What is the most appropriate initial treatment for a patient with diabetic ketoacidosis, DKA? A. Administer insulin and 4 fluids. B. Administer oral glucose. C. Start dialysis. D. Give a beta blocker. Answer. Administer insulin and 4 fluids. Rationale. The most appropriate initial treatment for DKA involves administering insulin to reduce blood glucose levels and intravenous fluids to correct dehydration and electrolyte imbalances. Oral glucose is not appropriate because the patient is in a state of hyperglycemia. Dialysis and beta blockers are not indicated in the initial treatment of DKA. 60. What is a primary complication of untreated hyperthyroidism? A. Thyroid storm. B. Hypoglycemia. C. Osteoporosis. D. Hypercalcemia. Answer. Thyroid storm. Rationale. Thyroid storm is a severe, life-threatening complication of untreated hyperthyroidism characterized by fever, tachycardia, and altered mental status. Hypoglycemia, osteoporosis, and hypercalcemia are not common complications of hyperthyroidism. 61. Which of the following is a common side effect of corticosteroid therapy? A. Weight loss. B. Hyperglycemia. C. Hypotension. D. Increased calcium levels. Answer. Hyperglycemia. Rationale. Corticosteroid therapy can lead to hyperglycemia due to the medication's effects on glucose metabolism. Weight gain, increased blood pressure, and hypercalcemia are more typical side effects. 62. A patient with a history of diabetes presents with a wound that is not healing. What is the most likely cause? A. Diabetic neuropathy. B. Diabetic retinopathy. C. Diabetic microangiopathy. D. Insulin resistance. Answer. Diabetic microangiopathy. Rationale. Diabetic microangiopathy, which affects the small blood vessels, can impair wound healing in diabetic patients. Diabetic neuropathy and retinopathy are not directly associated with wound healing. Insulin resistance affects glucose metabolism but does not directly impede wound healing. 63. Which of the following is the most appropriate nursing action for a patient with Addison's disease during an acute crisis? A. Administer hydrocortisone as prescribed. B. Administer intravenous glucose. C. Restrict sodium intake. D. Encourage physical activity. Answer. Administer hydrocortisone as prescribed. Rationale. In an Addisonian crisis, the patient is deficient in cortisol and aldosterone. Hydrocortisone should be administered immediately to replace cortisol. Intravenous glucose is not necessary unless hypoglycemia is present. Sodium restriction and physical activity are not appropriate during an acute crisis. 64. A patient diagnosed with hypothyroidism has been prescribed levothyroxine. When should the nurse instruct the patient to take the medication? A. On an empty stomach in the morning. B. With breakfast. C. With lunch. D. Before bedtime. Answer. On an empty stomach in the morning. Rationale. Levothyroxine should be taken on an empty stomach in the morning, typically 30 to 60 minutes before meals, to ensure optimal absorption. Taking it with food can decrease its effectiveness. It is not recommended to take levothyroxine at bedtime or with other meals. 65. Which of the following is the most common symptom of hypoglycemia? A. Sweating and tremors. B. Increased thirst and urination. C. Nausea and vomiting. D. Weight gain. Answer. Sweating and tremors. Rationale. Sweating and tremors are common signs of hypoglycemia as the body reacts to low blood sugar levels. Increased thirst, nausea, and weight gain are not typical signs of hypoglycemia. 66. Which of the following hormones is produced by the adrenal glands? A. Insulin. B. Epinephrine. C. Cortisol. D. Thyroxine. Answer. Epinephrine. Rationale. Epinephrine is produced by the adrenal glands as part of the body's stress response. Insulin is produced by the pancreas. Cortisol is produced by the adrenal cortex, and thyroxine is produced by the thyroid gland. 67. What is the primary function of glucagon? A. Increases blood glucose levels. B. Decreases blood glucose levels. C. Stimulates protein synthesis. D. Increases calcium levels. Answer: increases blood glucose levels. Rationale: glucagon raises blood glucose levels by stimulating glycogen breakdown and gluconeogenesis in the liver. It does not lower blood glucose, stimulate protein synthesis, or increase calcium levels. 68. Which of the following is a common symptom of hyperthyroidism? A. Weight gain. B. Bradycardia. C. Increased appetite. D. Cold intolerance. Answer: increased appetite. Rationale: hyperthyroidism typically causes symptoms such as increased appetite, weight loss, and tachycardia. Cold intolerance is more common in hypothyroidism, and bradycardia is not associated with hyperthyroidism. 69. What is the primary action of beta blockers in the treatment of hyperthyroidism? A. Decrease heart rate and blood pressure. B. Inhibit thyroid hormone production. C. Stimulate thyroid function. D. Increase metabolic rate. Answer: decrease heart rate and blood pressure. Rationale: beta blockers are used in hyperthyroidism to decrease heart rate and control symptoms such as tachycardia and hypertension. They do not affect thyroid hormone production directly. 70. Which of the following is a sign of severe hypercalcemia? A. Vomiting. B. Increased urination. C. Hypotension. D. Muscle cramps. Answer: vomiting. Rationale: severe hypercalcemia can cause nausea, vomiting, and confusion due to the toxic effects of elevated calcium levels. Muscle cramps and hypotension may also occur, but vomiting is one of the key signs of severe hypercalcemia. 71. Which of the following conditions can result from prolonged use of corticosteroids? A. Cushing's syndrome. B. Hyperthyroidism. C. Addison's disease. D. Hyperparathyroidism. Answer: Cushing's syndrome. Rationale: prolonged use of corticosteroids can lead to Cushing's syndrome due to excessive glucocorticoid exposure. Hyperthyroidism, Addison's disease, and hyperparathyroidism are not directly associated with corticosteroid use. 72. Which of the following is a characteristic of diabetic nephropathy? A. Proteinuria. B. Polyuria. C. Weight gain. D. Hyperglycemia. Answer: proteinuria. Rationale: proteinuria is a hallmark sign of diabetic nephropathy, where the kidney's ability to filter protein is compromised. Polyuria, weight gain, and hyperglycemia are not directly associated with diabetic nephropathy. 73. Which of the following lab values is commonly elevated in patients with hypoparathyroidism? A. Calcium. B. Phosphate. C. Magnesium. D. Potassium. Answer: phosphate. Rationale: in hypoparathyroidism, calcium levels are low and phosphate levels are elevated. Magnesium and potassium are not typically affected. 74. What is the priority intervention for a patient with hyperkalemia? A. Administer calcium gluconate. B. Give oral potassium supplements. C. Administer sodium bicarbonate. D. Increase fluid intake. Answer: administer calcium gluconate. Rationale: in cases of hyperkalemia, calcium gluconate is used to stabilize the myocardium and prevent life-threatening arrhythmias. Sodium bicarbonate and increased fluid intake may help lower potassium levels, but the priority is to stabilize the heart. Oral potassium supplements are not used to treat hyperkalemia. 75. What is the initial treatment for a patient with an adrenal crisis? A. Hydrocortisone administration. B. Insulin administration. C. Intravenous glucose. D. Sodium bicarbonate administration. Answer: hydrocortisone administration. Rationale: the immediate treatment for an adrenal crisis is the administration of hydrocortisone to replace deficient cortisol. Insulin, glucose, and sodium bicarbonate are not primary treatments for adrenal crisis. 76. What does the presence of exophthalmos typically indicate? A. Hyperthyroidism. B. Hypothyroidism. C. Cushing's syndrome. D. Addison's disease. Answer: hyperthyroidism. Rationale: exophthalmos, bulging eyes, is a characteristic sign of hyperthyroidism, particularly in Graves' disease. Hypothyroidism, Cushing's syndrome, and Addison's disease do not typically present with exophthalmos. 77. What is the primary goal of therapy for patients with diabetic retinopathy? A. Prevent blindness. B. Control blood pressure. C. Prevent nephropathy. D. Increase insulin sensitivity. Answer: prevent blindness. Rationale: the primary goal of therapy for diabetic retinopathy is to prevent blindness by controlling blood sugar levels and managing retinal damage. Controlling blood pressure is important but secondary to the primary goal of preventing blindness. 78. Which of the following findings is most consistent with pheochromocytoma? A. Severe hypertension and tachycardia. B. Hypotension and bradycardia. C. Weight loss and polyphagia. D. Increased appetite and polyuria. Answer: severe hypertension and tachycardia. Rationale: pheochromocytoma is characterized by severe hypertension and tachycardia due to excessive secretion of catecholamines. The other options do not match the clinical picture of pheochromocytoma. 79. Which of the following conditions is most commonly associated with Hashimoto's thyroiditis? A. Hypothyroidism. B. Hyperthyroidism. C. Cushing's syndrome. D. Addison's disease. Answer: hypothyroidism. Rationale: Hashimoto's thyroiditis is an autoimmune disorder that leads to hypothyroidism due to the destruction of thyroid tissue. It does not lead to hyperthyroidism, Cushing's syndrome, or Addison's disease. 80. Which of the following is the best method to diagnose acromegaly? A. Serum growth hormone levels. B. MRI of the brain. C. Glucose tolerance test. D. Bone density scan. Answer: MRI of the brain. Rationale: the best method to diagnose acromegaly is through an MRI of the brain, which can identify pituitary adenomas that cause the overproduction of growth hormone. Although growth hormone levels and glucose tolerance tests may be useful in diagnosis, MRI is the definitive method for identifying the cause of acromegaly. 81. What is the main cause of Addison's disease? A. Overproduction of cortisol. B. Destruction of adrenal glands. C. Hyperthyroidism. D. Autoimmune disease. Answer: B. Destruction of adrenal glands. Rationale: Addison's disease is caused by damage to the adrenal glands, resulting in insufficient cortisol and aldosterone production. 82. Which of the following is a common complication of uncontrolled diabetes mellitus? A. Hypercalcemia. B. Diabetic ketoacidosis. C. Hypothyroidism. D. Hypoglycemia. Answer: B. Diabetic ketoacidosis. Rationale: diabetic ketoacidosis, DKA, is a severe complication of uncontrolled diabetes, characterized by hyperglycemia and ketosis. 83. Which condition is associated with the presence of a moon face? A. Cushing's syndrome. B. Addison's disease. C. Hyperthyroidism. D. Acromegaly. Answer: A. Cushing's syndrome. Rationale: a moon face, characterized by round and puffy cheeks, is a hallmark feature of Cushing's syndrome due to excessive cortisol production. 84. Which of the following is the most common cause of primary hyperparathyroidism? A. Parathyroid adenoma. B. Hypercalcemia. C. Renal failure. D. Parathyroid carcinoma. Answer: A. Parathyroid adenoma. Rationale: the most common cause of primary hyperparathyroidism is a benign parathyroid adenoma leading to excess parathyroid hormone, PTH, secretion. 85. What is the most appropriate diagnostic test for hypoglycemia? A. Random blood glucose test. B. Fasting blood glucose test. C. Oral glucose tolerance test. D. Hemoglobin A1C test. Answer: A. Random blood glucose test. Rationale: A random blood glucose test helps quickly identify hypoglycemia by measuring the blood glucose level at any time of the day. 86. What is the main cause of hyperparathyroidism? A. Parathyroid adenoma. B. Hypercalcemia. C. Vitamin D deficiency. D. Hypothyroidism. Answer: A. Parathyroid adenoma. Rationale: hyperparathyroidism is commonly caused by a benign parathyroid adenoma, which results in excessive production of parathyroid hormone, PTH. 87. Which of the following is a sign of hypokalemia? A. Muscle weakness. B. Tachycardia. C. Hyperreflexia. D. Bradycardia. Answer: A. Muscle weakness. Rationale: hypokalemia often presents with muscle weakness as potassium is critical for muscle function and contraction. 88. Which of the following is associated with pheochromocytoma? A. Hypercalcemia. B. Tachycardia and hypertension. C. Hyperthyroidism. D. Weight loss. Answer: B. Tachycardia and hypertension. Rationale: pheochromocytomas, tumors of the adrenal medulla, secrete excess catecholamines causing tachycardia, hypertension, and other symptoms. 89. What is the main treatment for Graves' disease? A. Antithyroid medications. B. Radioactive iodine therapy. C. Thyroidectomy. D. Levothyroxine. Answer: A. Antithyroid medications. Rationale: antithyroid medications, such as methimazole or propylthiouracil, reduce the production of thyroid hormones in patients with Graves' disease. 90. Which of the following is a complication of untreated hyperthyroidism? A. Osteoporosis. B. Cushing's syndrome. C. Weight gain. D. Hypercalcemia. Answer: A. Osteoporosis. Rationale: chronic untreated hyperthyroidism can lead to osteoporosis due to the increased metabolic rate causing calcium loss from bones. 91. What is the main risk factor for the development of type 2 diabetes? A. Obesity and lack of physical activity. B. Excessive salt intake. C. Low calcium diet. D. Frequent infections. Answer: A. Obesity and lack of physical activity. Rationale: obesity and physical inactivity contribute to insulin resistance, a key factor in the development of type 2 diabetes. 92. What is a common cause of secondary hypertension? A. Diabetes mellitus. B. Kidney disease. C. Hyperthyroidism. D. Cushing's syndrome. Answer: B. Kidney disease. Rationale: kidney disease, particularly chronic kidney disease, is a common cause of secondary hypertension due to fluid retention and altered renin-angiotensin system. 93. What is the most appropriate treatment for a patient with diabetic ketoacidosis? A. Insulin therapy. B. Oral hypoglycemics. C. Fluid restriction. D. Anti-diabetic diet. Answer: A. Insulin therapy. Rationale: insulin therapy is critical to treating diabetic ketoacidosis as it helps to lower blood glucose and correct ketosis. 94. Which of the following is a common symptom of hyperthyroidism? A. Weight loss despite increased appetite. B. Weight gain with decreased appetite. C. Cold intolerance. D. Bradycardia. Answer: A. Weight loss despite increased appetite. Rationale: hyperthyroidism leads to increased metabolism, causing weight loss despite increased appetite. 95. What is the first-line treatment for an acute adrenal crisis in a patient with Addison's disease? A. Oral corticosteroids. B. Intravenous hydrocortisone. C. Intravenous sodium bicarbonate. D. Fluid restriction. Answer: B. Intravenous hydrocortisone. Rationale: intravenous hydrocortisone is the main treatment for adrenal crisis, providing the necessary cortisol replacement in a life-threatening situation. 96. Which of the following is characteristic of myxedema coma? A. Hyperreflexia. B. Hypothermia and bradycardia. C. Hyperglycemia. D. Tachycardia. Answer: B. Hypothermia and bradycardia. Rationale: Myxedema coma is a severe form of hypothyroidism, presenting with hypothermia, bradycardia, hypotension, and altered mental status. 97. What laboratory finding is most commonly seen in diabetic ketoacidosis, DKA? A. Hyperkalemia. B. Hypoglycemia. C. Hyperglycemia with ketonuria. D. Hyponatremia. Answer: C. Hyperglycemia with ketonuria. Rationale: DKA is characterized by hyperglycemia and the presence of ketones in the urine, caused by fat metabolism due to insulin deficiency. 98. In which condition would a patient most likely present with a thyroid storm? A. Hypothyroidism. B. Cushing syndrome. C. Hyperthyroidism. D. Addison's disease. Answer: C. Hyperthyroidism. Rationale: thyroid storm is a life-threatening condition associated with severe hyperthyroidism, presenting with high fever, tachycardia, and agitation. 99. What is the most common cause of hypothyroidism? A. Autoimmune thyroiditis. B. Hyperthyroidism. C. Iodine deficiency. D. Parathyroid adenoma. Answer: A. Autoimmune thyroiditis. Rationale: the most common cause of hypothyroidism is autoimmune thyroiditis, particularly Hashimoto's thyroiditis, which leads to destruction of thyroid tissue. 100. Which of the following is the primary function of insulin in the body? A. Regulate metabolism of carbohydrates. B. Stimulate the release of glucose from the liver. C. Inhibit protein synthesis. D. Promote breakdown of fats. Answer: A. Regulate metabolism of carbohydrates. Rationale: insulin helps regulate carbohydrate metabolism by facilitating glucose uptake into cells and promoting its storage as glycogen.